Hi, Alvin here, and you are watching episode 41 of the 3-Minute Health Tip. In this episode, I'm going to talk about Crohn's disease and colitis. For many people that look up what Crohn's and colitis is about, usually it involves some sort of inflammatory process that affects the colon or small intestine, leading to symptoms such as severe cramping and severe diarrhea. Oftentimes, clinically, we've seen people that have been dealing with Crohn's or colitis for many years, and it actually leads to a lot of anxiety as well, because people are really afraid to go out for fear of not being able to handle any of the foods that they eat and leading them to have severe pain or having to rush to the bathroom. We're going to look at this condition that many people are suffering from with the lens of the 5 biological laws and the knowledge of G&M. So as you know, when we look at any symptom, regardless of the disease name, we're looking at the actual organ that's affected. And as we mentioned, when it comes to Crohn's and colitis, we're looking at the small intestine or the colon. The brain control relay that's involved with Crohn's or colitis is the brain stem. That's what's affected. And the conflict, the unexpected event, the unexpected conflict shock that triggers the biological program is known as an indigestible morsel conflict. So what does that mean? That means something that made you angry or upset, a person, a situation, a circumstance, a comment, a criticism. Oftentimes, people that suffer from severe digestive issues that become diagnosed as Crohn's or colitis, around that time that those symptoms start to show up, or actually just prior to it, they were dealing with an unexpected conflict, an unexpected event that they subconsciously and subjectively perceived as an anger, something they couldn't absorb, they couldn't digest. And that's what leads to the symptoms that starts to show up in the healing phase, or when they start to come to terms with their situation. And so clinically, we've been able to help a lot of people identify what their original conflict was that led to their Crohn's diagnosis or their colitis diagnosis. For a lot of people, it really comes down to situational issues regarding their work. There's a new manager, a new boss that comes in town. There's some conflict where they feel like they're being picked on. It creates this anger that leads to their symptoms. And early on, those symptoms start to show up mostly around their work environment. And then for other people, we've had a lot of clients or patients dealing with Crohn's or colitis as it relates to relationship issues. You know, it started around their teen years when their parents were getting divorced, when there was a significant falling out between them and their father, for example, and that leads to their digestive issues or the anger. And then for some, it's a relationship issue. Their boyfriend or girlfriend cheats with them with their best friend. That leads to a lot of anger. That was unexpected. And that leads to the symptoms that they start to experience. And so for those of you, or if you are a practitioner helping people with Crohn's or colitis, one of the questions you want to look for is, around the time that these symptoms showed up, what was going on unexpectedly in your life that was hard to digest, that was hard to accept or absorb, and that was making you angry or upset. And again, being able to really make that connection as the source of this biological program and the symptoms is the first step in helping you to finally get some relief. So I hope that that health tip serves you. Thank you as always for your attention, and I'll see you at the next episode.